This is the spine tumor. Again, 30% of a patient will develop spine metastatic diseases. CyberKnife is so powerful that we can treat the bone, the vertebral body, at the same time spare the cord easily. So on the left side is easy case. We only need to treat one vertebral body. In the middle, we need to treat a full vertebral body. It's very, very complicated. On the right side is the most complicated cases. We treat a 3 vertebral body. We spare both cord and also the nerve. So it's very complicated cases. But the CyberKnife, thanks to the robot, is so flexible. It's so flexible. We only treat the tumor. We can spare the cord and also the nerve. We can spare the normal tissue. So clinically, there are more than 10,000 papers already been published, and all has shown excellent clinical outcome. For spinal tumor, many paper reports 90% local controls. For prostate paper, published by Memorial Sloan Kettering, the best cancer center in the world, it shows 97% of the local control.
哦，咖啡灌肠，你要跟他们讲咖啡灌肠。
Versus conventional radiation, only 89%. So what this means? What this means? CyberKnife in 1 week has 97% of rate of success. Conventional radiation takes 7 weeks, only have 89%. And the surgery is even worse. So on the right side, the early stage lung cancer, the small lung nodule. This is the data that is published by MD Anderson in America, the best cancer center, of course, in the world. You can see for lung cancer, CyberKnife has better survival than surgery. CyberKnife has a better survival than surgery. It has the same local control, but survival is higher. Why? Because the CyberKnife has much less side effects. So when we have an older patient, when the patient cannot tolerate surgery, the real surgery, or patient does not want the real surgery, we could definitely offer CyberKnife. So clinically, what CyberKnife do? We can use the CyberKnife to treat a brain tumor and head and neck cancer, including the brain mets, including GBM, the primary brain tumor, TriGem neurology, the pain, right? The pain, AVM, etc. And many times you may have a patient had a gamma knife, had a linear accelerated radiation before, and the tumor come back. And then you can still come to us to get a re-radiation with the CyberKnife. For lung cancer, as I mentioned, you can treat early stage lung cancer or late stage lung cancer. Or the patient may have a metastatic disease to the lung. For example, the patient may have a breast cancer. Breast cancer being treated, but you have a metastatic disease to the lung. Guess what? We can also treat with the CyberKnife. So we can treat liver mets, and we can treat primary liver. We can treat pancreatic liver. We can treat spine tumors and the prostate tumors and many other tumors. So basically for almost all the solid tumors, and except for the esophageal cancer, for the bladder cancer, and the stomach cancer, except these 3 cancers, almost for all other cancers, there's opportunities that we can treat with the CyberKnife. So basically, CyberKnife had been approved in 2001, and so I started CyberKnife in 2003. I'm one of the earliest guy using CyberKnife in the world. And in 2006, I moved from Miami to Philadelphia. I co-founded the Philadelphia CyberKnife. And in 2013, I became the chief physicist and chief scientist for Alliance Oncology. At Alliance Oncology, I manage 16 CyberKnives. And in 2015, I started to draft the guidelines for QA quality control guidelines for CyberKnife in United States. In 2020, I went back to China. I feel that CyberKnife helped. I have used CyberKnife helped about 6,000 American cancer patients. I feel this is wonderful technologies. I should use this technology to treat Asian patients. That's why I moved back to China in 2020. And in 2022, we bought our own CyberKnife in Foshan, in Guangzhou, in China, and which is one of the very, very premium cancer CyberKnife center. And by the way, our CyberKnife center become a training center for Asia. So all the new CyberKnife users in China, in Southeast Asia, if they are doctors, they are physicists, will come to my center for training. It had been seen Warren Buffett had prostate cancer, and Steve Jobs had pancreatic cancers. Both of them had.
WellAgain, Total Healthcare Solutions.